Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Psychotropic medications. Many people with intellectual and developmental disabilities are on medications for psychiatric conditions. There is a higher incidence of mental health conditions in people with intellectual and developmental disabilities, but I would also say that there's probably an overdiagnosis of mental health conditions in people with disabilities, because oftentimes people that are having adverse behaviors are placed on psychotropic medications to try to control those behaviors. And there may or may not be an actual psychiatric condition that's happening. It can often be because of environment or underlying medical conditions. But let's go with the fact that someone does need a psychotropic medication. There are some good prescribing habits that we should consider when a person is placed on one of these medications, because they're not without risks. So we need to do our best to minimize the potential risk, the potential side effects, and maximize any potential benefit. So before prescribing these medications, we really should try to make sure that we have a mental health diagnosis and know exactly what we're treating. If for some reason a person is being placed on one of these medications, particularly to look for a behavior, then we should identify that behavior. We should know exactly what it is. We should have a goal for treatment and continually reassess that person is meeting those goals or not. And if it's determined that the medication is not having the effect that we're hoping that it would have, it's not improving the life of that person, then that medication should be discontinued. We don't want to just keep on adding another medication on top of another medication on top of another medication. We have to look at when we're trying to determine if something is working, we can look at behaviors and document these things in terms of the intensity of the behavior, the frequency of the behavior, and really chart those over time to see if there is a reduction or an improvement in these symptoms that we're really trying to target. So, these medications can have additional problems associated with them. They can increase the risk of what we call metabolic syndrome, which is hypertension and diabetes and obesity. They can cause weight gain. All of these things are not good for someone's health. So we need to be very careful and very cautious in prescribing medications. Now, we always talk about in any medication or most medications to start low and go slow. So we want to start at a lower dose, and as soon as we find a dose that's effective, then that's where we need to stay at, so that we don't use more medication than is necessary. And go slow as we have these increases to give the medication time to work. Now, if a medication has been determined that it's not working and we decide we want to take a person off of that medication, you usually should consider tapering those medications very slowly as well too, because sometimes abrupt withdrawal of a medication can cause other issues, including sometimes seizures, because a lot of medications that are used for behavior can also be used for seizures as well. And if we quickly stop those medications, it might stimulate someone to have seizures, even in a person who hasn't had seizures before. So be really careful about that. Be really aware of the medication side effects so that you can observe for signs and symptoms of side effects that might be appearing. And those side effects might look differently in people with intellectual and developmental disabilities. So lots of things to consider when using medications. But we always need to be thinking about what's best for that person and prescribing medications in ways that can be helpful and reducing the risk of harm. So thanks for joining me. You can find out some more information in Clinical Pearl number 47 in the book Clinical Pearls in IDD Healthcare. And we look forward to seeing you next time.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com. Go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in No Time, kind of as a compliment to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek mini. So thank you for watching. We'll see you next week.